Hello, my name is Rachel Ludy. I'm one of the nurse educators for Mercy Hospital Trauma Center in Janesville, Wisconsin. This video is going to give you a step-by-step instructions on how to utilize the rapid infuser and also maintenance of the rapid infuser. The rapid infuser tubing is located in the towers on the left-hand side of the room, is in room 1 or 2. The kit looks like this, and also one hangs from the device so that it's easily accessible. When running the rapid infuser, it's highly important that one nurse is dedicated to the rapid infuser at all times. That is solely that nurse's responsibility and only her responsibility. This rapid infuser can run at high rates. So we're going to go ahead and set up the tubing, and what I would do, and unfortunately these are already primed just because it's a practice device, but what I would do is go ahead and clamp these sections right here. I would then go ahead and seat it into the device, and then I would prime my tube or spike my bags, whether they be saline or blood products. After that, then you can open these up and go ahead and prime and run the device. Continuing and setting up the tubing, you want to go ahead and I take the device's circle piece. I look for the red arrow and I insert it inward with the red arrow going upward. This provides me a good base of where to go from there. Once I've done that, I find the blue arrow on this device and I place it in this section right here. It does go above the seated spot, not below. Most people want to put it below and it's actually above. You put that in there, follow the tubing down. Again, big blue line for the big blue tubing, little blue line for the little blue tubing. You've already seated this device. Go ahead and take this piece over here, seat the circle, bring these tubings downward, just like that. Again, little piece, little line, big piece, big line. And then you can go ahead and close the door. The door is a little hard to close, so you have to take a little force with it. Once it's secured, it's secured. Once you have locked your door, you're ready to go ahead and prime the unit. So go ahead and make sure that your tubing is unclamped and hit prime. The priming will prime approximately 100 mils through the device, ensuring that all the air is released from the device through this chamber right here. As you can see, there's multiple things on here. The important ones are the temperature. As we warm this device will warm your patient. You have a bolus and you have a rate. These two right here, this will show you how fast it ramps up, and this one will show you how many mils are in there. So let's say I want to go ahead and bolus my patient. I hit that button and you will start to see that it's ramping up and giving the fluid. You can see how much is going in the patient. If I want to increase the rate, increase it right here. Once that bolus is entered, let's say I want to stop it. So once I've given my bolus, I'm ready to go ahead and start an infusion. You have to remember these are mils per minute. You can go as high as up to 750 mils per minute, which means 4,500 mils per hour. So please be careful in how much you're giving and how much fluid you have hung. There is a cheat sheet that is attached to the device that hangs from here, and it gives you not only instructions, but it also gives you how many mils you are giving per hour based on mils per minute. So please be aware of that. On the back of that device, there's also a cheat sheet on converting the temperature from Celsius to Fahrenheit, as the device uses Celsius. If you have any further questions, there is the catalog or the manual for the device on here. There's actually 2 copies, and it tells you some important information regarding solutions, how to set it up, etc. To sum it all up, the rapid infuser is very important when taking care of our patients that need rapid, large amounts of fluid or blood products to treat them. The rapid infuser is not necessarily needed just for a patient to get rapid infusion of 1 or 2 products. Please make sure that you utilize pressure tubing bags for this, as they are very accessible, easy, and do just as good of a job. But if your patient is going to require multiple units of blood, multiple bags of saline or LR, please make sure that you are using the rapid infuser correctly and that one nurse is dedicated to that line, as the bags of fluids can empty very quickly and the nurse needs to be aware of when to change them. The tubing should be changed every 4 hours or less if using blood tubing. When you hook up the rapid infuser to a patient, it is very, very important that you're hooking it to a large bore catheter, whether it be a central line, a 14 gauge, 16 gauge, or 18 gauge needle. You will have much difficulty trying to run high pressures through a 20 gauge needle. It is also very, very important that you remove the cap at the end of the loop to our catheters, as that cap also creates pressure. Some other difficulties that staff has had is not being able to bolus a patient or running the heater through the device. You cannot do these when the device is not plugged in. So it's an always good point of practice to make sure that the rapid infuser is plugged in when being utilized. If you have any questions, please make sure you contact the education department. Thank you for listening.